Good morning, everybody. This is Dr. Kirti. I'm basically practicing in Karwar. I'm working in Nagamangala Hridayalaya, which is an intensive unit of Karwar. We are treating patients since last 6 years with the help of this hospital. Today, I'm here to speak about care at home after heart attack. It's one of the most common disease is heart attack. So basically, there are a lot of people have a question after heart attack, how to take care of them with all the risk of the life. So today I'm here to explain few points which will definitely help to the people to take care of them after heart attack. So basically, when you admitting in the hospital, generally a doctor admit the patient of heart attack 3 to 5 days. So if everything goes well, generally after 5 days, people are discharging. But in very very rare cases where the risk is more, where certain arrhythmias or certain other risks, generally they keep for a longer time. When patient is discharged with certain medicine like aspirin, like ACE inhibitor, beta blocker, nitrates, and antiplatelet or statins, so these medicines are going to help the conditions of the patient by preventing repeated heart attacks or any arrhythmias. Basically, one of the major risks for a cardiac attack is arrhythmias as well as cardiac failure. We can call it as pulmonary edema, repeated pulmonary edemas or arrhythmias like ventricular tachycardia, ventricular fibrillation, or some other arrhythmias where definitely patient will get into where endangers his life. So basically our goal should improve the quality of life after the heart attack treatment or after the discharge from the hospital. Basically people or patient should be comply with the medicine. This is one of the important factors where we need to follow the doctor's instruction with all the medication, like aspirin, which is very helpful to prevent the further blockage, or to if the patient is on stent, to stent blockage can be prevented by antiplatelet or aspirin. Antiplatelets are like clopidogrel, prasugrel, ticagrelor. There are many varieties. So either of one will be given to the patient, and unless the doctor says these medicines should not be stopped. Generally, these are all long-term medications. Like aspirin is a lifetime medications, and beta blocker, where beta blocker will control the heart rate and it will reduce the overactivity of the heart. By this, it will prevent the problems of the or repeated heart attack or second heart attacks. And nitrates, basically it dilates vessel and it will allow more flow to the heart, more blood flow to the heart, which will help again to prevent angina or any chest pain. And statins is basically lipid lowering agent. It can be atorvastatin, rosuvastatin, simvastatin. So these kind of drugs will prevent or reduce the cholesterol level of the body, and thus it will prevent further heart attacks or any further complications. So cardiac rehabilitation is one of the important factors to save the cardiac patients or MI post heart attack patients. Here there are mainly three components we are always stressing to the patient. The number one is exercise. Number two, reduce the risk factor. Number three, deal with the stress, anxiety, and depression. These all three factors are playing so important role. We have to balance our life with these three factors. At least if all three are not possible, at least one or two we have to follow to prevent further damage to the muscle, cardiac muscles, or the risk from the cardiac problems. Exercise. There are a lot of questions from the people how to go about the exercise. Commonly, my patients are asking what level of exercise is required and how far we can do it. Matlab, how long we can do walking or any aerobic exercise. See, these are all depending on the patient's age and patient's cardiac activity or ejection fraction, we call it as. If there is a low ejection fraction, we advise patient not to exert much. Maybe 20 to 30 minutes of walking should be good enough for them. Or those who have got a very good ejection fraction, or maybe the younger and other risk factors are less. So in such cases, we can allow them to go for at least 45 minutes to 1 hour. Again, you have to talk to your own doctor for your exercise capability. Maybe a treadmill test after the MI, after certain days, we'll be advising to go ahead for a treadmill test, which will definitely will guide you how best you are able to manage with the walking or how long you can go. With these tests, we can assess patient's capability of walking or exercise. Generally, we advise at least 5 days in a week of walking is ideal. And next is reducing risk factor. There are a lot of risk factor which patients are carrying, like smoking. Smoking is one of the major risk factor for the cardiac patient. If patient reduces or stops smoking in 1 year, further 1 year, the risk of further MI or any other problems will reduce by 50% of it. If patient doesn't smoke for 2 years, you can say the person's risk of getting into other MI and normal individual, it is almost equivalent. So stoppage of smoking is very, very important aspect in any rehabilitation care. So one more major rehabilitation factor is deal with the stress, anxiety and depression. These are one of the very, very important aspect for a present scenario. The people gets into more stress will have a more risk for a cardiac issue. Any depression or anxiety will lead into further cardiac problems like re-attacks or arrhythmias. So these things has to be optimized. You should try to manage to escape from the anxiety or stress. So there are a lot of stress involved, like working stress, your financial stress, familial stress. So those things you have to balance with maybe psychological opinion, psychologist opinions may be helpful, and your working pattern. If it is you feel it's a very stressful work, you try to solve these things with your superior, how best you are able to manage it. Or when you are not able to manage the work, you can change the job or change the place. These are some of the solutions you can find out with a work related stress. The depression is something which you need a psychologist help or psychiatrist help. So if you overcome these factors, definitely you will be strong enough to fight against cardiac issues. So the next is the managing a certain risk factor like hypertension, like high cholesterol level, and diabetic. Diabetic is also one of the major risk factor for any cardiac patient. So how to control diabetic? Basically with a good diet. Most of them are knowing what are the diets for diabetic. Basically, you have to reduce sugar moieties, you have to reduce starch items, additional sweets. So all those things you have to reduce. Monitor your sugar level regularly. If it is beyond the limit, then you have to meet your doctor to control that. Regular exercise, regular medication, regular follow-ups will control your diabetic as well as hypertension, which is very, very important in controlling cardiac problems. One of the most common questions for the young MI patient we observe, the question will be like how to go about the sex life. Generally, we advise them to avoid for a 6 week. Generally, for a 6 week, it is not safe to have sex because the cardiac muscles will take some time to come out of whatever the stress it has with the MI. So it required time to recover from that, at least 6 weeks. So we call generally all the patient not to involve in these act because it's it considered to be one of the strenuous act. Some people will have certain issues with ejaculation and other things. Though such cases, they have to meet their doctor. There are certain medication like sildenafil and tadalafil which will help them in a proper dosage form. Then any of the patient, they want to come out of everything like stress, the guidelines from the how to control with the diabetic, how to control with the hypertension, how to control their cholesterol. They have to meet their doctor regularly as well as a dietitian where they will give you the guidelines for the food. So most of the cardiac problems can be controlled by the good diet habits, very disciplined life and regular checkup. With all this care, definitely we can win these cardiac problems. See, cardiac, once there is an MI, so there is always a chance of fear of second MI, arrhythmia, sudden death, or pulmonary edema, or we can say cardiac failure. So these things we can prevent by good care, good exercise, regular medications, and diet habits. You can meet your dietitian for all these things. Most of the patient, what we are seeing is compliance of medication is not 100%. So some of the patient, when they feel good, they stop their medication by their own. Definitely, this is something is going to harm your cardiac or your life also. So don't do that. Please don't stop any medication without advice of your doctors. There are certain medication, we will try to reduce it over a period of time. Certain medication has to be lifetime. Like aspirin, we cannot stop once there is a cardiac or any brain stroke related to ischemic. We have to continue this medicine for a lifetime. So rehabilitation is one of the very, very important component to prevent further problems in a heart attack patient. So everybody, please be safe, follow your doctors, follow your exercise, you do regular exercise, reduce your mental stress, try to be happy with your life. Definitely you can be safe from further cardiac damage. I wish you all the best. Thank you.